What's up, guys? Just last week in my village, I heard of this young guy who had a fracture. He went to the village hospital. There's a clinic, and he stayed there for like 2 weeks. Before I know it, his family rushed and discharged him forcefully against the doctor's advice. Eventually, they took him to traditional bone setter because they believed that fractures will be healed by tying it tightly and by applying herbs. Needless to say that eventually he developed some serious complications and had to be rushed back to the hospital so that he can be managed well. Why? Because when the herbalist tied that leg, he ended up cutting off blood flow. And as a result, blood was no longer flowing to the leg. This was a serious complication, and his leg, needless to say, had to be amputated. Because by then gangrene had formed. It was already black in color and it was already getting really bad. So they had to cut it off so that whatever was wrong would not get to other parts of the body. And this is the reality of many people, but you never hear about it. You only hear about people that got recovered by the traditional bone setters. So how did we even get to this place where we think that tying a fractured leg or hand and applying herbs is how to heal fractures? So imagine in 1492, a guy has a fracture and the village traditionalist or herbalist applies herbs and ties it, and the fracture heals perfectly and the guy goes home well. But what we do not realize is that there is what we call a simple fracture. A little fracture that just maybe like a cut like this, just a cut. So all you needed to do was just keep the leg one place and it will heal because the body heals itself. But there are other kinds of fractures that are what we call comminuted fractures or oblique fractures, different kinds. In fact, comminuted fractures happen and all the bones are scattered around the place. If you do what the herbalist did for that simple fracture, that person is going to suffer because the bone might heal, but the leg is probably going to be bent or what we call bagolo bagolo. So for a fracture to really heal, number one, you need blood to be flowing to that area, so that cancels out the tying. And then number two, you need to align the bones properly. If the bones scattered like that second case scenario, then you need someone to go in there and put the bone fragments one after the other and make sure they are properly aligned. That's the job of an orthopedic surgeon. That's why they do this surgery. They need to arrange the bones so that everything will be straight. After it has become straight, then they use a cast and hold it in place. That's why it takes time. So they put you there and to allow the bone to heal, to fuse in a correct state. So if there was no cast, you see that the bone will heal, but it will heal maybe one kind and look like this. If you're looking at the person's leg, it will look like this. Look at the person's hand, it will look like this. Something, you know. And so many adults walking around with one leg shorter or one bone crooked are victims of these myths. Every physiotherapist knows the heartbreak of seeing preventable deformities that was rooted in native treatment. Science is not your enemy, man. Guys, see, some people argue, but our ancestors used herbs, yes. But they also used stones for childbirth. Yes. They also did bloodletting to cure fever. They will cut the person so that fever will go. But now you are taking malaria drugs. In fact, they even thought that epilepsy was witchcraft. So should we continue those ones too? We don't reject tradition, but we upgrade it with knowledge. If your phone spoil, you know, go carry leaf, go repair them. So why will you do that with your bone? So herbs can soothe pain, but they can't fix alignment. No one is dragging herbs with anybody. They have their own uses. Antiseptic, anti-inflammatory, mild pain relief. But you see, healing fractures? Nah. Gentlemen, I have seen and heard things. But nothing in the world could have prepared me from what I'm about to say now that I heard. People really believe that bones will realign themselves with time. How? This one, I mean, because maybe they assume that bones have Wi-Fi connection and the brain can auto-adjust. Guys, bones are not transformers. They do not rearrange themselves like Optimus femur. Because when a bone breaks and shifts out of place, it stays exactly where it shifted unless someone trained moves it back deliberately. Your bones don't have GPS. They don't trace their way home. They don't say, I beg, make I shift small so that the leg might go feel waka normally. No. If a fracture is not aligned properly, the bone will heal in the wrong position. We call it malunion, guys. And when it heals wrongly, your leg, your arm, or your wrist will permanently bend in the wrong direction. So time doesn't realign bones. Time only cements the error. It's like cement. If you pour it crooked, it will dry crooked. So this myth has destroyed more limbs than accidents themselves. If bones realigned naturally, then what are orthopedic surgeons? I mean, they will just give you paracetamol and say, go home, bone will find itself. But instead, bones must be set gently, professionally, under proper imaging, then immobilized in the correct angle. It's now then that wait time will help healing. All right? Leave alignment to the experts. Okay. There's another myth that I hear that scratches my ear, and that is using native bone setters is safer than hospital. Well, if native bone setting was safer, then emergency ward would be empty. I mean, native bone setting is sort of safe the same way driving a car with no brakes is sort of safe until the day it isn't. Most complications orthopedic doctors battle today started from bone setters, tight bandages that lead to gangrene, misalignment, permanent deformities, nerve damage, compartment syndrome, infections, delayed healing. I mean, native bone setters treat fractures like they are treating sprain. They tie, they squeeze, they massage, and they pray. But, well, bone doesn't respond to squeezing. They respond to reduction, which is proper alignment. They respond to immobilization, proper casting. They respond to controlled loading, which is what physiotherapists help to do. Hospitals use x-rays. Hospitals use x-rays, sterile tools, and evidence-based protocol. So, bone setters use kerosene, prayers, herbs, and inshallah. There's nothing wrong with tradition, but health is not for trial and error. A hospital fracture repair has a standard procedure, but native bone setting is just vibes and inshallah. If you honestly compare the two, the difference is like day and night. Hospitals manage fractures, bone setters often create new ones. You see? So your safety is not about culture. It is about what? Competence. All right, myth number 4 is that massaging with kerosene and hot cloth heals fracture. Oh boy, kerosene, oh boy. Kerosene no be medicine now. Heat is not glue. Massage cannot reattach bones. A fracture is not a muscle tension. It is a broken solid structure. Sure, you go use super glue, gum iron. That don't make sense. So massaging a fracture is like shaking a broken TV and hoping that it will mend the wires inside. You're only increasing swelling and pain. So kerosene has no pharmacological benefits for bone healing. The only thing kerosene is good at is smelling like hardship and suffering. What about heat? It increases blood flow, but increased blood flow to a swollen fracture means more swelling, more pressure, and more risk of nerve damage. Fractures need support and agitation. Fractures need support, not agitation. They need stability, not vibration, guys. They need alignment, not kerosene evaporating on your skin. The hot cloth may feel soothing for muscle aches, but for bone, it's like putting balm. But for your bone, it's like putting balm on your heartbreak. It's emotionally comforting, but practically useless. If kerosene healed fractures, then every filling station attendant will be a bone doctor by now. Please leave massage for muscles and leave kerosene for your lantern. But leave fractures for professionals. Alright. Guys, I heard another thing that blew my mind. Myth number 5, that if you can move your leg after an accident, it means it's not broken. This myth has deceived more people than bad network. Being able to move your leg does not mean your bone is fine. It only means your muscles are still doing their jobs. There are many people that have been in an accident and never knew that they were bleeding profusely. They were still able to run and they felt fine. In fact, there's one that was stabbed and he was bleeding from his chest. It turns out that even his lungs was perforated, but he didn't know. He thought it was fine until he escaped that accident scene. Sorry, until he escaped that danger scene, because it was adrenaline that was pumping through his body. He didn't feel it. He didn't feel the pain. It turns out after that he collapsed and was rushed to the hospital. Thank God he survived. So the fact that after an accident you are walking doesn't necessarily mean that something didn't go wrong. Maybe you are having adrenaline pump. You know, so your brain, so your muscles, so your bone can break, but your muscles are still contracting. Simple. Some fractures are hairline fractures, tiny cracks that still allow movement. Some fractures are non-displaced, meaning the bone is cracked but still in its position, but you get cracked. Some fractures are around joints, and because joints allow movement, you can still shake your body, even though something inside is crying. And then the hero behavior, since I can move it, you're not too serious, my brother. You are literally using movement to worsen the crack. Movement does not diagnose fractures, pain, swelling, bruising, inability to bear weight, deformity. It's only X-ray that does. Even athletes run on broken bones, thinking it's sprain, until the bone finally gives up, like NEPA. If movement alone proved health, then every person with cracked ribs who still can breathe is fine. But you know, rib fractures hurt like hell. So being able to move doesn't mean that nothing broke. It simply means your body is still functioning despite the injury. So don't use vibes and inshallah to diagnose fracture, okay? Use the hospital. I heard something today that my ear one burst. In fact, this one is not just for everybody. This one is for also our doctors in Nigeria. My dear doctor friends and the masses. Who told you that once the cast is removed, that the patient does not need therapy? Huh? This one is the main reason many people walk like they are still carrying invisible cast. A cast protects the bone, yes, but it also weakens the muscles, stiffens the joints, reduces circulation, and reduces coordination. By the time the cast comes off, your arm, your leg is like a car that has been packed for 3 months, dusty, stiff, uncoordinated, weak. That's why physios exist. That's why physiotherapists exist. So a physiotherapist will restore what the cast temporarily stole: the strength of muscles, flexibility at the joints and soft tissues, balance, joint mobility, proper gait, proper use of the limb. If you skip physiotherapy after cast, your bone might be healed, but your movement will be rubbish. You think your body is back, but really your muscles are still on sabbatical leave. Limbs, they don't magically bounce back just because, plaster is gone. No, cast removal is not graduation. It's like the beginning of real recovery. And that's where the physiotherapist ensures the healed bone is actually useful, not just healed. No. Please refer to physiotherapist after cast. And if you're a patient and you know someone that has been on cast, or you, after that cast, tell your doctor, please refer me to a physiotherapist. God bless you. Now, myth number 7, using hot water cures all joint pain. Ajay. See, hot water is not Panadol for joints. Are you hearing me? Hot water helps some conditions, but it worsens others. If you use hot water for all joint pain, it's like using sugar for all cooking. It works in some meals, but please don't put sugar inside jollof rice. Because heat increases blood flow, relaxes the muscles, and reduces stiffness. But heat also increases inflammation and swelling, and sensitivity in conditions like acute injuries, like fresh sprain or new arthritis flare-ups, or swollen joints. So when people say just pour hot water solves everything. What they are doing is baptizing the joint in suffering. So heat does not equate healing. It's useful for chronic stiffness or old injuries or muscle, not open injuries though, or muscle tightness. But for fresh injuries, heat is the worst thing you can apply. It's like adding fuel to already burning fire. Joint pain has many causes: arthritis, injury, tendinitis, gout, infection, and each requires specific care. Hot water is not anointing oil. It's not a one-size-fits-all miracle. It's not Bobo Nise. Bobo Nise that cures everything. No be me talking. And myth number 8, arthritis is caused by exposure to cold. Doctor, anytime where I feel pain and I on fan, my body go dey pain me more. I don't know why. It be like say fan or AC, if they make me they feel pain. Well, that symptom might be real. But arthritis is not caused by exposure to cold or rain. This one is our African favorite. Rain falls, my joints are paining me. Arthritis. Cold breeze blows. This harmattan don't start my arthritis again. Let's be honest. Cold can trigger pain in people who already have arthritis, but cold does not cause arthritis. Arthritis comes from wear and tear. It be like you wear slippers as you dey match them for ground every year. You don't dey wear, they come out for back. Simple. So that wear and tear now for your joint. Waiting they cause an old age or age can increase it, obesity can increase it, overuse can increase it. If you be person where they carry things up and down, they work up plenty, they do sports, it can increase the risk. What about autoimmune issues, genetics, infections, metabolic problems, and all of them follow? Rainwater has never entered anybody's joint. Cold air is not a disease. If cold caused arthritis, I mean, even everybody in Canada will be limping like penguins. So arthritis is a condition of the joint structures, the cartilage, the synovial fluid, the bones. It no be weather disease. Weather only amplifies the symptoms you already had. So don't blame rain for a condition that developed from years of biology, lifestyle, or medical causes. Okay, so cold causes. Cold doesn't cause arthritis. Cold just exposes arthritis. You know, if your joint hurts more in cold seasons, don't fight the weather, just go and treat the joint. Okay. Now, so my people, I heard another one that blew my mind, that exercise makes arthritis worse. Dear doctors, dear patients, dear everybody, this myth makes arthritis patients avoid movement like movement is their enemy, but inactivity is actually the problem. Please, arthritic joints need movement to stay healthy. Exercise improves lubrication of joints. It be like say engine way day. If you know the move, waiting to happen, stiffness. But if they begin the move, what happens? The oil will circulate. Exercise strengthens those muscles that are around the joint, like shock absorbers. Exercise improves flexibility, improves balance, and reduces pain long term. So what makes arthritis worse is the wrong kind of exercise. You are running on bad joints, wrong. You are jumping, that's wrong. Heavy lifting, that's wrong. But gentle, controlled physiotherapy guided exercise. Some of you know, say as they prescribe drugs, they prescribe exercise. That's the job of a physiotherapist. Yes. So think of exercise like food for joints. The right portion heals it, but the wrong portion harms it. So avoiding exercise guarantees faster deterioration. But doing the right exercise, it guarantees long-term comfort. So don't fear movement, guys. Fear immobility, okay? All right. And myth number 10 is that if you have arthritis, you shouldn't move much. This myth is the reason many arthritis patients end up barely able to walk. When you avoid movement because of pain, the joint stiffens more, the muscles are weaker, and the pain actually increases. Because movement is not the enemy. The wrong movement is the enemy. Arthritic joints behave like a door hinge. You move it, the less, the more it creaks. When you stop moving, blood flow reduces, joint lubrication drops, cartilage nutrition decreases, and your body becomes like a rusted engine machine. But when you move gently, the joint gets warm, the muscle activates, the lubrication spreads, everywhere is mele mele. Everything is sweet and sound. No? So people think that rest means healing, but with arthritis, too much rest means trouble. Your joints need guided activity, not imprisonment. They need stretching, not freezing. They need strengthening, not hiding. Sitting in one place because I don't want it to pain me. It's like refusing to start your car engine because I don't want it to spoil. You only make things worse. So arthritis management is movement management. Physiotherapists don't push you to move because they enjoy So physiotherapists, they don't push you to move because they enjoy your groaning. They do it because science shows that controlled mobility is the real medicine. Movement keeps your joint alive. Immobility slowly kills it. All right? Have you hit that follow button? Hit it. Follow us for more. Like this video. Comment down below what you would like to see next. And remember to hit that subscribe button. Subscribe on YouTube, guys. By subscribing, you are recommending our videos to more people. If you love what we do, consider following us. And remember to drop what you want me to talk about. Is it confusing you? Is the topic confusing you? Talk to me about it and I'll make a video about it. Okay, cheers.